Agwest Veterinary Group is continually striving to help shape a sustainable future for the Canadian dairy industry. Mastitis is the most costly disease for the Canadian dairy industry. The cost of drugs, discarded milk, labor time, and reduced milk production for the remainder of lactation can make each case of clinical mastitis cost over $240.
There are many different pathogens that can cause mastitis in cows, and all respond differently in the way they react to treatment. Most farms treat all cases of clinical mastitis the same regardless of which pathogen has caused mastitis. This leads to irresponsible antibiotic use and increased costs of treatment.
By culturing the milk from a cow with mastitis before treatment, we can determine what has caused mastitis and decide whether she needs antibiotics. We can then specifically target our treatment to have the best outcome.
The culture-based mastitis treatment program at Agwest gives you the tools you need to treat, control, and monitor your clinical mastitis. How does the culture-based treatment program work at Agwest? When a case of clinical mastitis is detected on farm, take a clean, aseptic milk sample from the affected quarter. Make sure you clean the teat with alcohol thoroughly before taking the sample. Only a few good squirts of milk are needed for culture. Label the tube and put it in the fridge. Then either drop off the sample at the Agwest office or call the office and we will have the sample picked up. At the Agwest lab, we plate the milk sample and incubate it for 24 hours. In 24 hours, we can tell what kind of pathogen has caused the mastitis, and we report this directly to you on farm, along with a specific treatment recommendation for that case.
Using mastitis cultures to base treatment decisions benefit your farm in multiple ways. By the time visible mastitis is seen, a percentage of cows will have already cleared the bacteria that caused the mastitis, and antibiotics are not needed for treatment. Other types of bacteria respond very poorly to antibiotics and are cleared best by the cow's own immune system. These don't need antibiotic treatment. By culturing the milk, we can tell which cases we don't need to treat, which leads to a huge reduction in antibiotic use, which is good for the cow, your farm, and the public.
We can also pick up infectious causes of mastitis that pass from cow to cow. By identifying these cows right away, we can limit the spread of these infectious pathogens.
Agwest is encouraging all farms to reconsider how they treat their clinical mastitis. The culture-based treatment program will help all farms, no matter how big or how small, use less antibiotics, have better control of their mastitis, and improve their sustainability and profitability.
You can find more information on the culture-based treatment program at Agwest by clicking on the link below.